Thank you all for being here today. My name is Cameron Cummings. I am the Community Impact and Marketing Associate here at United Way of the Concho Valley. Today, we're celebrating Men's Health Month, and we're lucky to have Dr. Ralph Worster here from Shannon Medical Center just to talk briefly about men's health. Dr. Worster, will you introduce yourself and kind of tell us a little bit about your role at Shannon and what you do there?
Hi, my name is Ralph Worster, and as you mentioned, I'm a family physician here at Shannon. Uh, my role primarily is outpatient evaluation and management of all the men and women in the surrounding areas.
Thank you so much for taking time out of your day to talk a little bit about men's health. June is Men's Health Month internationally, so we'll kind of jump right into a couple questions. So tell us, what are some of the major trends that you're seeing with possible health concerns in men's health, and then if that's any different in San Angelo?
Well, I think most of the issues that we see are the same as they've been as far as diabetes, high blood pressure, heart disease, prostate cancer, which of course is a very important issue as far as men's health is concerned. Some treatments have evolved over the years, and in this particular area, I would have to say that diabetes is a big problem, and we are seeing a lot of mental health issues and unfortunately substance abuse and alcoholism in this particular area. I work with Shannon, I work at Rivercrest, I work at Los Bronze, so I have a lot of hands in different areas, but overall, I think treatment remains focused on the same areas. We just try to encourage men, especially and their family members, to get annual wellness exams, make sure they get their prostate exams or at least PSAs, colonoscopies, and routine follow-up and lab, and so forth, in order to address those issues. Of course, if there's specialists involved, we also encourage them to see their specialists. But most important thing from my perspective is getting routine care and routine follow-up to establish what the problem areas are and address them accordingly.
So you talked about, what those health concerns were in especially in San Angelo. Have you seen, obviously we've been going through COVID-19 the last 2 years. Have you seen a possible increase in men visiting the doctor to have those checkups and things like that because of health has been such the forefront of the world recently? Have y'all seen an increase in that?
Absolutely. Unfortunately or unfortunately, depending on your viewpoint, we've seen less people coming in, and I think that's attributed to the fact that we've had vaccines, and thank goodness there has been a downward trend in the COVID, although recently there has been a little bit of an uptick. But during the height of the pandemic, there was a tremendous influx of out of concern, obviously, for getting COVID and preventing COVID, so that was helpful. And oftentimes we utilize that same time period to make sure that all their other needs are care of at the same time.
So a little bit before, you talked about kind of what your recommendations for your health, and I know my parents were very big on making sure that I went for my yearly visits, and that's kind of ingrained in my head now. So when you recommend, what do you recommend for men to do for their health other than yearly visits? Are there things that they need to watch for as they age? And, other than, I know that we want to stay healthy. We know we need to eat well and work out, but are there other things they can do to mitigate any kind of health risks that you talked about?
From my perspective, making sure you get proper sleep is always helpful. Getting your fasting lab work to check your cholesterol, your PSA. Oftentimes, as men are getting older and living longer, we even oftentimes check testosterone level, which can affect their muscle mass and their bone mass, and that can impact their health overall as well. But eating healthy, exercising, extremely important in order to help maintain health, and obviously our goal is to live longer. So live longer and healthier at the same time.
So when you talked about all the things that you're kind of involved in, La Esperanza being one, Shannon, and then some of the mental health side, are there any, other than Shannon, are there any other resources that you see in San Angelo that somebody could reach out for? I know there's there's many practitioners at Shannon that do just exactly what you do, family practice and things like that. So kind of what are your resources that you recommend or that you see around town?
Well, obviously Shannon has an extremely well behavioral health unit. They also have their own substance abuse and treatment centers, and so obviously we utilize those. Oftentimes patients may not have the resources themselves to obtain that help. So La Esperanza is available. There's Journey Recovery Center. There's Rivercrest, which can also assist as far as substance abuse and mental health issues, at which I utilize all of them depending on the availability to the patient.
Yeah. Well, San Angelo is a great place, and I'm glad we have people just like you that serve this area and that can talk to all of us about not only men's health but just our health in general. It's so important, and like you said, in this day and age, it's extremely important with what's going on. And then, like you said, we want to live longer as well. So I really appreciate you talking with me today and discussing men's health and what men can do to really mitigate those factors and what they could look for and the resources that San Angelo has. So I really appreciate it. So thank you so much.
Thank you.